And we're back with the Business Spotlight. I'm Patrick Dewar. You're going to love today's show. Today it's Dr. Trerel Myers, Dallas Laser Dentistry, 2011-2012 Cosmetic Dentistry Award winners for the last few years. Dr. Mary Swift has been, and Dr. Trerel works with Dr. Mary Swift, who's been on the show many times, and we're always thankful to have him back. So thank you so much again.
You're welcome.
I want to get into really what makes you and your practice so special, because you're doing a lot of things that are real. I don't want to say high end, but the technology and the cosmetic stuff in dentistry it's different from the way it used to be, isn't it?
Definitely different. And you know, with managed care, we've seen a decrease in quality overall in dentistry. And dentists are seeking less expensive labs to make the crowns. And I read a review here 2 or 3 years ago that insurance were getting to ask to replace crowns every 3 to 5 years. I've got crowns that have been in the mouth 35 years that are still functioning as good as the day I put them in.
Wow.
And that's because if you take time to do it right the first time, you don't have to take time to do it over. And so that's where a lot of my training has been is, you know, one of my mentors, Dr. Pankey, used to quote Michelangelo a lot. And one of his favorite quotes was, "Perfection is no trifle, but paying close attention to many trifles make perfection."
Very nice.
And so a lot of what we do is paying very close attention to a lot of little details that takes more time. So, like I said previously, you know, my exam takes 2.5 hours. A lot of dentists only spend 15 to 20 minutes on an exam. But we gather a lot of information so that we can make a proper diagnosis.
Now, then, don't you go ahead and put together a plan or something? I mean,
Yes.
once somebody has gone through this process with you, what's your next steps?
On an involved case, which may be a full mouth rehabilitation.
Tell me a story of a client, somebody that's been through it. That would be kind of, we could walk through the process.
I had this one young man come in. He was probably, at that time, probably about 28, maybe 30. And he hadn't been to a dentist in several years. And I had treated his, pardon me, I had treated his wife, and she had been trying to get him to come see me for 4 or 5 years, and he was just scared to death. Well, when I did see him, he had some severe problems and couldn't smile, very introverted. And we ended up having to lose several front teeth, and he had to go through some gums treatment and orthodontics and jaw surgery to move his jaw properly. He couldn't afford to do all that, so we did that over a 5-year period.
Nice.
To allow him to be able to do that. And part of my training is making a thorough exam and then evaluating what will need to be done over a lifetime. Now, if you've got a plan, you can work that plan, but you don't have to do it all at once. You know where you're going. You've got the end point. So that's what we did with him. We allowed him to do it over a 5-year period. He completed everything. The next year, he made the front cover of a business magazine for what he had done, and he said, he brought that in, he said, "Dr. Myers," he said, "I wouldn't have been on this cover or in the position I am in with this company if it hadn't been for you allowing me to smile, which I couldn't do before."
That's a huge testimonial. Yeah. But it also shows the painstaking works that you do and planning that you guys do that makes such a huge difference. I think that's the thing that I really wanted to bring out. And I know that with technology, there's changes in speed and process and some of the other things, and that's cool. But what you're talking about is life-changing, and that's where it really comes down to, isn't it? Because I remember I was about to go to the oil field to pay for college one summer, and I had 2 days before I went out there, and I went into the dentist, and he opened up, and you know, he goes, 1, 2, 3, 4, 5. He was counting extra holes in my head from like a long ways off, and I was like, oh God, this is going to be bad. He goes, well, you got 11 extra holes in your head. We can do it over the next 3 weeks. So you got 2 days. He goes, you ain't going to feel or taste nothing. And so off we went, you know, and I was, it was an adventure, but
but now we have nitrous oxide, and we have things that makes it a lot more fun.
Well, that's an interesting thing. Nitrous are there risks involved in nitrous oxide? To be honest,
very little risk. It's one of the best things that has allowed my patients to have the comfort and the relaxation. We use stereo headphones so that they can tune us out and just enjoy.
Really, so really you kind of put them in a bit of a state,
right?
You know, so they're resting, and then you'll go to work, do your thing,
and they're clear-headed before we leave.
Yeah.
So it's very safe.
Yeah. Yeah, I'll remember. I think a lot of us remember the old Three Stooges things where somebody had a little bit too much happy gas.
Yeah.
And so. Yeah. As we go into this next segment, we're going to be talking more about who's the ideal client for Dr. Trerel Myers. This is the Business Spotlight. You're going to love this next segment. We'll be right back.